Hi Acupressure and Wellness fans, it's Diego Roig. And in this short video, I just wanted to share with you several visuals of the point I've been talking about for the last few days, Gallbladder 21. And as you know, it's an acupressure point which coincides with a common trigger point located right at the top of the shoulder. And so here you can see, if you see that light green line that comes down from the neck, that's the gallbladder meridian line. And you see how right where I've got the acupuncture needle, right in that point, gallbladder 21. And that's the point that we want to apply pressure to, okay? Bringing it down this way. And you see how it's, it's kind of really at that high point of the shoulder. Gallbladder 21, that's where its location is. And you can use to effectively stimulate or treat this point, you could use thumb pressure, you could use elbow pressure, and just go in kind of gently and apply the amount of pressure, the right amount of pressure that feels right for you and for the person that you're applying the pressure to. Let's move over to the second visual I have for you. And here's the second visual, which is an image of the two trigger points located in that same area of gallbladder 21. Now, when that muscle is tight, and it gets tight because it has to balance the head, it has to anchor the head, which is like a bowling ball on a toothpick, and so it gets tight. And if you work at a desk, then it'll get tighter quicker because of the position of your head and your neck, yeah? And what happens is it develops what is known as a characteristic referral pattern of pain and nerve sensation following the arrows. So what happens is the trigger points get tight and they refer nerve sensation this way, yeah, around to the eyes. And what happens is when that trigger point goes untreated and it creates a satellite trigger point, then the image above, you see how now these satellite trigger points become trigger points of their own, and they refer pain and nerve sensation into the side of the head, simulating a migraine headache, and also into the teeth. And so now you've got areas of low blood flow and high nerve activity in the teeth. And that can create problems for you. So I'm here to say that just by learning how to treat trigger points and acupressure points, you can increase blood flow and decrease nerve activity and increase range of motion and decrease the frequency and intensity of nerve pain and muscle pain that often has people reaching for over-the-counter painkillers. And this is all naturally, and it's easy to learn. I want to share it with you. And so the last image here I want to show you is the image of the body with all the many acupressure points, and then also energy lines running along the body and the muscles and the nerves and the joints. Yeah, and the gallbladder meridian starts by the eye and runs the entire side of the body all the way down to the baby toe, the ring toe. So if you treat a point anywhere along that line, you are influencing the whole line. So here we are, gallbladder 21. When we treat that point, we are also stimulating energy flow throughout the whole meridian, right? Okay. All right. So anyway, thank you for your time today. And that is, this is a little video on gallbladder 21 and 3 visuals for you. Thank you.